Dr. Fizzia. I'm a consultant physiotherapist specialized in women's health, and I'm working with ReLiva Physiotherapy and Rehab. Very often we come across women with a bulge or something protruding out of the tummy or a discomfort in the tummy. This can be diastasis recti. Okay. Now, what is diastasis recti? A rectus abdominis muscle which extends from your xiphisternum to your pubic symphysis in a pair joined by a connective tissue in between is called rectus abdominis muscle. During pregnancy, this muscle gets elongated, stretched and is under mechanical stress all the time, which causes the muscle to separate from between. This is commonly seen in people who have delivered recently. Who is more prone to diastasis recti? Women who have delivered recently, women with multiple pregnancies, women who carries one or two, more than two babies, or women who have a narrow pelvis, or women who have been resting throughout their pregnancy. Now, what is diastasis recti? When the muscle, abdominal muscle gets separated, leading to an opening from between, there is a protrusion or bulging out of the organs. This is called as diastasis recti. How severe is diastasis recti? Diastasis recti is about 2 to 3 centimeters wider to 15 to 20 centimeters longer. If opening is too small, then it is not going to be an issue. But if the separation is more than 2 centimeters and as long as 15 centimeters long, then you have to consult a physiotherapist to get help for the same. How do I know if I have diastasis recti? How are you going to know if you have diastasis recti? If you feel there is a bulge in your tummy, or you are having back pain or any discomfort in your abdomen, then please visit your physiotherapist or your consultant to get the help for the same. Please do not ignore diastasis recti because it is initially not a severe condition, but if ignored, it can lead to complications. How are we going to check if we have diastasis recti? You can always visit a physiotherapist to get yourself checked. But also you can check at home if you have diastasis recti. You can do a self-test. How are we going to do a self-test? If you feel you're suffering from diastasis recti and you want to do a self-test, so please lie on the bed, on your side, turn on the bed, flex both the knees with the feet separated, okay. Place your fingers above and below the belly button right in the center. Lift up your head and your shoulders. If your fingers dig inside, then it means you're suffering from diastasis recti. Turn to your side and wake up again from the bed. Yes, as a physiotherapist, I recommend that women should get their rectus abdominis muscles checked during their pregnancies and immediately after the delivery to check if there is any separation in the muscle. Fortunately, physiotherapists can help you deal with diastasis recti and get 100% of results. As there is no medication that can heal diastasis recti, we have a rehabilitation program for the same. What can we do for the treatment? As a physiotherapist, we advise you to use abdominal binders, do some exercises like abdominal retractions. We can do core rehabilitation and pelvic floor rehabilitation. What are the things that you will not be doing in diastasis recti? The don'ts of the diastasis recti are: you will not be lifting any heavy weights, you will not be doing any abs or crunches, you will not be doing any exercises or of core rehabilitation without having or seeking help from a physiotherapist. What are you going to do with diastasis recti? You are going to use abdominal binders regularly. You are going to visit your physiotherapist and do the exercises for the correction of diastasis recti. If the condition is very crucial, severe, please do not worry. We have treatment for the same. We can always give you currents to help you regain the strength in the abdominal muscles. As a women's health specialist, I would recommend that we should have checks for rectus abdominis muscles to see if you're suffering from diastasis recti during the pregnancy in the prenatals, after the delivery in the hospital and in the postnatal sessions. It is a fun fact that the women who have been doing the prenatals regularly are very less likely to get or suffer from diastasis recti. If you feel you're suffering from diastasis recti, please do not hesitate to visit us at ReLiva clinics near you. We are here to help you with your problem. Thank you.